Good evening, everybody. Today I'm here to talk about the most commonest problem what we women are facing nowadays, which is called PCOD, which is nothing but polycystic ovarian disease. Nowadays, I see a lot of posts, women telling that I'm not having my cycles or my periods regular. I've been missing my periods. I've been putting on a lot of weight. I'm facing a lot of acne issues. I'm not able to conceive. I'm having miscarriages. So many things. And this at the end they say, yes, I am a patient of PCOD. So today, let us understand what is this PCOD, what are the problems associated with PCOD, what causes PCOD, how to overcome this PCOD. As I see, PCOD is nothing but a hormonal imbalance condition. So what happens in this PCOD? Usually PCOD patients, they present with symptoms of missed cycles or not getting their periods. Some present with excessive acne on their face. Some present with putting on too much weight in a very short span of time. And others present with hirsutism or facial hair, the hairs which grows in the mustache area, the chin area, the upper part of the chest. Excessive hair growth. This is also one of the most commonest presentation of PCOD. And some say that I'm not able to conceive. Some say I've been having miscarriages on and off. So there are so many presentations of this PCOD. What happens in PCOD? Normally, a woman has to get her periods every 28 to 32 days once and bleed for about 3 to 5 days. In this PCOD patients, they do not get periods regularly. Sometimes it may be delayed like 45 days, 60 days, or not get at all. They have to take tablets to get their periods. Why this happens? See, women produces a hormone called estrogen and male usually produces androgens and testosterones. When there is an imbalance in this hormone production, that is more commonly seen in obese patient. When a woman is obese, so who are these obese women? Indian average weight is 50 kgs. A woman's Indian average weight is 50 kgs. When she is overweight or obese, what is this overweight? See, normally the BMI of a woman, that is the body mass index, it should be between 20 to 24.9 or less than 25. Anything between 25 to 30 is overweight and anything above 30 is called obesity. So a overweight woman or an obese woman, in these people there will be a lot of fat. This fat gets converted into estrogen. So in PCOD women there will be a lot of estrogen production because most of the PCOD women will be obese and lot of estrogen. This excess estrogen is not good for our ovaries. What is this ovary? Ovary is nothing but the egg factory in a woman where the eggs are produced. When there is excess estrogen, this prevents the ovaries from producing eggs. So this prevents them from getting their cycles. There are some women telling that I get my periods every month but still I am not able to conceive. Yes, let me tell you, this PCOD patients, they produce eggs or they might not produce eggs but still they might be getting periods. And the quality of the eggs what they produce may not be of optimal quality or good quality. So say we have seen women telling that, yeah, I had problems of conceiving. I went to my doctor. She said that I have been producing eggs and she told me to have a timed intercourse, but still I did not conceive. So what is the reason for this? As I told you, the quality of the eggs which a PCOD woman produces are usually not of good quality. So when a not good quality egg undergoes a fertilization process, the chances of conceiving is also low. Some women say, yes, I produced eggs, my doctor did a scan, she checked my ovulation and still I did not conceive. As I told you, the reason is poor egg quality. Some women still produce eggs and their urine pregnancy test also becomes positive, but still they end up with miscarriage. Again, the reason for this is a poor egg quality. So these are the problems which a PCOD woman faces. And the most commonest cause for this is increased estrogen production. Why this increased estrogen production? Because of excess fat. Why excess fat? Obesity. Why obesity? Lack of exercise, junk eating, lot of stress, some medicines like antidepressant, and unhealthy sleeping habits, sleeping too late in the night and getting up too late in the morning, non-exposure to sunlight, no natural synthesis of vitamin D3 in your body. Again, all these causes leads to PCOD, hormonal imbalance. So we see different presentation in PCOD patients. As I said you, one is not getting their periods, acne, lot of acne, facial hair, and the other thing is darkening of the neck below the hairline, which is called as acanthosis nigricans, hyperpigmentation. These are the clinical presentation. Now when I talk about the ultrasound appearance of a PCOD patient, they say I'm thin, I'm not obese, but my doctor did a scan and she says I have PCOD. So what does the ovaries look like in a scan? Usually ovary will have one or two follicles which are nothing but like bubbles, water bubbles. But in PCOD patients, it will be studded with many water bubbles which are nothing called cysts, polycystic appearance. So this is what we see in the ultrasound. And we see that women might be very thin. Again, the reason PCOD patients need not always be obese. They can also be thin and present with PCOD symptoms. They can the causes for PCOD in a thin woman is thyroid issues, lot of stress, as such abnormal lifestyles, not exercising, eating too much of junk, late sleeping, non-exposure to sunlight. Anything can be a cause for thin women facing with PCOD. So these are the presentations. Now when I talk about the metabolic presentation of a PCOD, usually what happens in PCOD patients is there will be lot of insulin resistance in their body. So because the insulin resistance is there, what happens? The glucose level increases in a PCOD woman. So they have a tendency to eat abnormally and become diabetic. The other thing is they start producing lot of abnormal androgens or more of male hormones when they have PCOD. That is the reason for getting facial hair, acne, hair fall, skin darkening, neck area darkening. These are the reasons why PCOD patients get acne and all. So one is increased insulin resistance and increased male hormone secretion leading to acne and facial hair. So now what are the complications a woman faces? Some women, because as I told you, excess estrogen is always harmful for the ovary. It might not produce good hormones, and these good hormones do not act on the ovaries and she doesn't get her periods at all. So this is a reason she will miss her periods, and to induce that periods she has to always take tablets. The pregnant, the reproductive age group, these women face problems of conceiving. As I told you, the ovaries might not be able to produce eggs, or the eggs which are produced in a PCOD woman are always or most of the time of low quality and leading to either non-conception or miscarriages. The other complications what a PCOD woman, if she becomes pregnant, she faces is she has a higher tendency of becoming diabetic. Why diabetic? As I told you, they have a lot of insulin resistance, and that's the reason her glucose levels goes high and she becomes diabetic. So she tends to become diabetic, hypertensive if she is obese, and the chances of passing on this diabetic condition to her offsprings or the newborn is also high. And the other thing is, if when a pregnant lady develops diabetes, the chances of the kid or the newborn baby having heart related issues is also very high. And again, the same hereditary continues, like the newborn also developing diabetes at an early stage, obesity. If it's a female child, again it is a it also develops PCOD. Next, what happens post the reproductive age? They say PCOD women are highly prone to uterus related cancer or the endometrial cancer, because what happens in this PCOD patient is there is an inner layer of the uterus which is called endometrium. Since there is a lot of hormonal imbalance in this PCOD patients, this uterus layers are exposed to this imbalance. Over a certain period of time, they undergo abnormal changes and they tend into cancerous. So the chances of endometrial cancer in this PCOD patients are very, very high. So ladies, this is all about PCOD, the complications associated with PCOD. So now how do we overcome this? The first and foremost, maintaining an ideal weight is very, very important and the most important treatment step in PCOD patients. If you're overweight, at least reduce 10% of your body weight. So what is this 10%? If you're 70 kilos, 10% of 70 kilos is 7 kilos. Reduce that 7 kilos. That itself will increase the metabolic rate in your body and bring a hormone regularization in your body and decrease your PCOD effects. Important is weight reduction. It can be either in the form of exercise. Now what about how much should a woman exercise? Yes, at least 5 days in a week an exercise is a must. 30 minutes a day is a must. 5 days in a week is a must. If you are above the BMI of 30, then you have to double the duration of exercise. A 30 minutes of workout and or 4 to 5 kilometers of walking, brisk walking. So now what is this brisk walking? 4 to 5 kilometers covered in 45 minutes is enough speed for a woman to lose her weight. And the most important part is diet. Cut down on your calories. You need to reduce by around 500 to 700 kilocalories of intake per day. That is a diet. So now you have to decide what you have to reduce in your diet to bring down that 500 to 700 calorie intake. It can be sugars, it can be your carbohydrates, it can be your starch, whatever. It can be your sweets, whatever. So the most important is reduce your calorie intake by 500 to 700 kilocalories. And let me tell you, late eating habits is very dangerous and is the most important cause for this PCOD. Whatever dinner you're taking, well before 7:30 to 8 o'clock, not later than that. In olden days, people used to follow early dinner. That they used to not have dinner before 6:30, but they didn't know the scientific reason behind that. They used to think there is no electricity, so anything might fall in our food, and we are will not be aware of what has been fallen in our food. Hula, insects, anything would have been fallen in your food, and we might eat that by mistake. So better eat the food well before the sun sets, that is well before 6:30. But the scientific reason is you have to have your dinner well before 3 hours prior to sleeping. So if you're sleeping at 10:30, 7:30 should be your dinner time. So this is the most important part. Now, is it something like PCOD women can never conceive? Definitely she can conceive. Now the medical technology is too much advanced. There is a remedy, but always conceive in a healthy way to prevent the complications during your pregnancy and passing on this hereditary disease to your offsprings. So weight management, diet is the most important treatment of PCOD. If you have still doubts regarding PCOD, you can always approach me. I am Dr. Shilpashree. You can always WhatsApp on 9739463172. I will give you an appointment and we can discuss about your problem. So this is just a small information of PCOD. I do not want to talk too much in detail. You still have doubts, you can always approach to me, and PCOD is definitely treatable. It's nothing like it is non-treatable. But let me tell you, you should also join your hands and help your doctors in treating your PCOD problem. So what is your part of helping your doctor in treating your PCOD problem? Ideal weight management, good eating habits, healthy lifestyle. These three you do, the rest of the things your doctor do, and it results in 100% success in treating your PCOD problem and helping you in conceiving, preventing you from endometrial cancer, and leading a healthy lifestyle. Thank you.